medications, how do you, when you're starting Bowen and they know that you're not supposed to be taking anything, will interfere with the Bowen therapy?
Sorry,
So like
you're not
if you
supposed
have
to
a
take.
patient who has like Parkinson's and they
Yeah.
have already been on a lot of medications,
Yeah.
and you start the Bowen therapy treatment, but you're not supposed to be taking like, any drugs or anything while you're doing
Hang
Bowen
on.
therapy? Or
No,
what do
that's
you
not true.
tell them?
No. If your scope of practice, and also you should not take people off drugs,
Yeah.
regardless, without totally knowing what you're doing or referring, to their doctor or to a naturopath or whoever that knows how to deal with that. You don't touch the drugs, okay? And also you just don't, because at this point, that's your baseline. When they start to improve, and this is what happened with the fellow with Parkinson's, he improved to the point that the drug was obviously creating side effects. Then his own doctor took him off because it was like obviously backfiring, not doing anything. And that's the thing. So even when we do, like we treat with Bowen people who have high blood pressure, when their blood pressure normalizes and they're still on all these drugs, what's going to happen? They're going to have massively low blood pressure. So it can be dangerous, which is why, we tell people, keep in touch with your main physician so that, they can monitor you, and you tell the patient, be aware of your symptoms. If you start to feel a bit dizzy or lightheaded, or check your blood pressure. If it goes down, then those drugs are going to harm you. You should then find a safe way to get off it, right? Yeah. So that's really important. It's good you raise this because it's not our scope of practice, and that's why, as Bowen practitioners, unless we have another license, we don't touch drugs at all. we refer or work with, and there's lots of people who will do that. In BC now, naturopathic doctors can do it, so which is easier sometimes because the mindset is a little bit more open. But GPs will take people off drugs if the drugs are not necessary. Obviously, they have to because it's dangerous if they're on it.
Yeah, I've had cases too where I'm doing healing work and the person will say, okay, I'm not going to take my meds anymore.
No.
Hey, I think you better talk to your doctor about that.
Yeah.
Nope, I'm going to do it anyway. And I said, okay, if you're doing that, you're doing it on your own.
Yeah.
I have no recommendation on that. I push you to do it through your doctor. But you have to be clear to cover yourself.
Yeah. Oh yeah. Imagine if you don't have the license for it, and they said, oh well, my Bowen therapist or my homeopath or whatever said to get off drugs, your history.
Yeah.
That would close the whole practice down. So you get really, really clear understanding of the scope of practice is essential, for them and for you, for your practice. Otherwise, you're done. Yeah. But thanks for sharing that.
If you're doing Bowen treatment, somebody takes a cortisone shot, you just say, okay, well, we're not going to do Bowen anymore.
Why wouldn't you? Where does the idea that drugs don't work with Bowen? I've never
Well,
heard this.
then how do you gauge though? If they feel better on the cortisone, how do you know if
Because it
Bowen
won't
is?
last. Cortisone doesn't last. It only lasts for a temporary time. By the third shot, it doesn't work at all. So it's easy.
Or should you just ask them, we'll come back in a few weeks then, when your pain comes back?
Their pain never goes completely away. It's extremely rare that it's completely gone. And I've had people who, in the course of even me treating them, I've done the second visit, let's say, and then they say, well, I'm scheduled for a cortisone shot because I planned this 6 months ago,
Right.
and blah, blah, blah. If they want to do it, right, fine, do it, see what happens. They always come back. It doesn't hold, right? That's, it's a shotgun measure that,
So you would
Doesn't
just
work.
continue working on them?
No, I might just say, well, okay, we
Let's
come back. We might have to clean some of this drug out of your system. We may want to work with the kidneys and rebalance the body or whatever. But ultimately, they'll come back when there's pain. I said, okay, well, good. If this works, I hope this will last for you. Like, you don't want to go against a person's strong belief system, right? And that's, again, very important because we're not God. We may not help them. If they feel they're getting helped, 100% go with where they're going, right? That's why I've refused people in my clinic if they say they're getting help somewhere else and they're doing better. I say, well, great. Why don't you continue with that therapist? Your body's responding to this. If for some reason it were not to work or be to your complete satisfaction, come to me at that point, right? That's what I do, because once the body is in the direction of healing, the body is so amazing. It doesn't matter what therapy they use, right? The body's in the process of healing. So why would I interfere? Why would I confuse the brain and add silly Bowen moves? You know, in that sense, right? It doesn't make any sense. So I'm really clear with aligning where the patient's at. And we know, I mean, at least now I know since I've done all this research, the placebo effect, right? It's massive. It's massive on all levels. Go with it. And I call it the positivo effect.
So would you
Big
say
deal.
then, if she feels a lot better after the cortisone,
Yep.
should I say, okay, well, let's wait a few weeks before we do the next Bowen treatment?
Yeah, just say, call me, you know, if this takes care of all your problems, great. I'm happy for you, of course I am. Like, if people are, you know, I'm not happy because I help them. I'm happy because they're better. And if they're not better, I'll help them, right? That's how I see it. So if they say, well, this, thank God I finally got in, I waited so long, I sure hope this will do the trick. Go for it. If it does the trick, bonus. My experience is that it doesn't usually do the trick. But I don't share that, because that's negative, right? So if you create, that's a nocebo effect. You give a negative thought, and then they're unsure about the treatment. They're not, the treatment as in the cortisone, they're not fully aligned, they have doubt. Well, under those circumstances, research shows that it does not work. The only way it works is if you're aligned with it. So let them be aligned. Like, ignorance is bliss. Like, let's not get that wrong. It's when you start to know something else, then you're screwed. Oops, that's my take. But I think it's my experience, it's true. Have you guys seen this? I mean, do you agree with me? You can disagree.
I agree.
Yeah, I agree. Okay.
Oh, Marilyn, you had that question about what?
Does Bowen address warts at all, whether it's plantar warts or warts, hands, wherever warts occur?
You know, I don't know if I can answer that honestly. I don't think I've had somebody come in saying, I've got warts, can you do Bowen? I've done it with homeopathy. Yeah, I don't know, you know, and I don't think I've been paying attention enough. Like, I don't recall a patient saying, oh, you treated my shoulder and my wart went away. So I don't know, you know, I don't see why at the moment, but I have got absolutely no experience with it. Yeah.
Would that bursitis protocol be something to try?
I mean, you could try it, certainly if you succeed in doing it, you know, let me know, because then we know that it can do that. I mean, I would, you know, do the whole body, because it's a viral issue, right? It's not just local, right? So it's a deeper immune issue. Does Bowen affect the immune system? Of course it does, right? Because it increases the lymph flow, you know, it takes away congestion, it increases, you know, oxygenation. So can it help the body fight viruses? Of course it can, right? So,
Just for Marilyn, Peter, my partner, had a wart on his finger since he was like a kid. He's always had it on there, and since I finished doing Bowen, and we've also been doing the detox holy tea, both of us have been doing it for this last month, it fell off the other day.
there we go.
So I don't know what it was,
So
but
you were just doing all the things that you learn and you're practicing on.
and then we've also been doing a detox tea, the holy
Okay.
tea detox, and then the other day he just pointed out that it's been gone, and he's going to go to the doctor and get it burned off and whatever, but he's had it since he was a kid.
Wow, okay. Very cool, see?
It went black first though, strangely enough.
Yeah. Yeah, that's not strange, right? Because that's the drying process, right? It'll do that.
And then it just falls off. So.
Yeah, it gets like necrosed, right? Because it's dead tissue, and then it's like, okay, it's not interested anymore. Good. Now we got that answered. And okay, yes, there's other factors, but I mean, there always are other factors, right? Like, life is at the same time as you do Bowen. There's no way around it. Right? Okay, any other questions before not that this is the last moment for questions. Is there anything else before I move on to more new stuff?
Plantar warts, which are like, it can cover a lot, bottom of the foot, it can be very painful for people.
Of course.
So you haven't had anyone come with that type of a thing then?
That I have not done homeopathy for? No.
Okay.
No. No, they would ask for homeopathy probably, so, yeah. No, because, I wasn't, it's like everyone with MS or with fibromyalgia, I always did homeopathy. And then when people started saying, well, no, my friend had Bowen for whatever, I want Bowen, then I went, okay, I'm gonna have to get over this prejudice I have, right? That maybe Bowen can do this, right? So I've had to challenge myself and do Bowen, and it worked, right? So, same with asthma, right? I'm comfortable with homeopathy. I wasn't comfortable with Bowen. Now I'm comfortable with Bowen, right? And the reason that I had to switch is because if they were, when you're recommended, go see somebody and she did this, right? And they just see massive changes. So the person who had MS had a friend who had fibromyalgia, who had been in treatment for years with every other thing. I did Bowen in that case, right? I don't know why, that's what happened, right? And then I had to do MS for her friend. I had to do MS. I had to do Bowen for her MS. She did not want to do homeopathy. So what I did, that was my first transition, what I did is, at no charge to her, I asked her if I could take her homeopathic case, because I wanted to ensure I had a backup to be able to help her in case the Bowen did not work, because I was so confident with homeopathy, right? So, and I never needed to go there. She completely healed with Bowen. So, yeah, I mean, we're always challenged, right, as therapists, right? It's up to us to expand and grow, right? Okay, any more questions?
Yes, what you do is I was doing the rhomboids, and actually I wasn't doing it very hard. Like I wasn't digging down or anything like that. I was really trying. But when I was going over some of the things, I could actually hear the cracking. And then all of a sudden this real pain went through her body.
Okay.
And then it passed. Now what exactly does that mean? Should I be leaving that particular part and not concentrating on that,
No,
or
so
what?
who would know the meaning of that in that sense? Like, what did it mean to her? Did she have, or him, or
It was her.
her? Did she have any sense of what that was?
Well, I could hear the crackling, and then
So
all.
crackling is just like crepidus, it's like extra calcification, it's
Okay,
the fascia, that's,
yeah.
whatever.
So I did that, and then she goes, ouch! And so she goes, ouch, of course my hands jumped off of her, because I go, oh no. And then it passed. And then I actually just finished it, was okay. But now, should have I done that?
Oh, wait, can I get pretty hard with you for a moment?
You can.
Okay.
Yes, I actually,
I'll be really
because I want to
honest.
actually know how to do it.
Okay, so what happens if you were the patient and your practitioner went, oh no, what would you feel?
Insecure, right?
Yeah, you'd feel like, oh my God, they don't know what they're doing. They don't know what's happening, right? You just told me.
Yeah, because she just completely shocked me at how all of a sudden she jumped.
I totally get the experience that you must have gone through.
Yeah.
But again, we're having a therapeutic relationship, right? So what happens is that you're performing a technique that is very gentle, that cannot hurt unless you're doing it completely wrong. But you're telling me you did it really gently.
Yeah, I was
There's
actually
nothing
doing
there.
it.
You're
I was,
doing-
yeah.
Okay, so it isn't because you went hard. It isn't because it's a hard technique. So where would a pain like that come from? What do you think?
Well, at first I thought maybe something was being stimulated in her body.
right? Okay, that's good.
Yeah, because that's, you know, when I thought of it.
Okay, so if, and again, I'd have to check, you know, if you think you're soft but you're hard like crazy, different story, then, you know, you're in learning process. So of course, we'll check the technique. But let's say you're doing it as gently as it's supposed to be. You cannot cause her harm with this. There's no way. So it's some reaction that her body has, some memory, whatever it is, a fascial pull, a muscle and spasm, something that's speaking up. So if that's the case, then your reaction to her, and like, does that make sense, first of all,
Yeah.
that it comes from her? Does this make sense to everybody? That it's likely her, not because you've imposed some brutal strength? Okay. All right. So if it's her, then your role is to speak to that, but from a position of knowing that there's nothing in your touch that could have caused pain, that it's bringing up stuff that needs to be healed.
So basically what, now because I've gone through that,
Yes.
is it's actually good in the one sense now, because you told me that,
Yeah.
is because when it does happen again,
Yes.
I will actually be prepared for it.
Correct.
And when it does happen, I'll just say, oh, well, that's good, and just keep on doing it.
Yeah. So I mean, and you know, and what I do in cases, because you know, when people, that's good, they'll go like, yeah, right, you don't care about me, and, you know. So
Yeah.
I use humor to humor the situation, right? You know, and so I'll make some sort of, I don't know, you have to be in the moment to do it right, so this is probably going to come out wrong, but I'd say something like who'd have thunk that something so gentle could, you know, cause your body to react so strongly, you know, like something that's, you know, maybe not in Shakespearean language, but you know, but I would use something to go, my goodness, your body certainly is feisty and able to respond, like something positive, but that acknowledges their shock to it. Or that must be pretty shocking to you.
So that they can be recognized that actually, that this did,
Yeah,
that they're not
otherwise-
imagining it,
They're
body
not
will-
imagining. No, because don't forget it. When, if this happened to you, you'd be going, "Oh, what's this?" Like, you know, I mean, right?
Mhm.
You wouldn't understand it. So you need to first reflect that they've been heard, right? That you hear what they're saying, and then you take the next step, which is you reassure them that their body knows what it's doing, which it does, right? If you do something gentle and there's a response, the body knows what it's doing. It's not going to create something stupid, right? And so that's why, that's why I want to be hard on you, because saying, oh
Yeah.
no, and this, it kind of, it breaks that trust and that connection, right? But this is fine, because this is why it's without any certificate, it's all practice right now. You tell them that you're in training, all of it is good, right? These are the learning experiences that, you know, we all go through, right? So there's no harm in it, and thank you for bringing it up, so that, you know, you're not the only one who's probably gonna do something like that.
Like
we get shocked.
it completely shocked me, like, 'cause
Yeah.
she probably jumped, I don't know how far off, you know.
Yeah,
And so then, of course, when she did that, oh no, that was my first,
yeah.
but, yeah,